Bonjour tout le monde. Hello everyone. I want to begin by addressing the COVID-19 situation in Manitoba. The record numbers the province has seen over the last few days is really concerning. In light of this surge, we're partnering with Manitoba First Nations to provide over $61 million in immediate funding to support their response. This funding will support public health measures, food security, and other surge capacity needs. In addition, Indigenous Services Canada is mobilizing contact tracers and equipment to further help affected communities. Of course, Manitoba isn't alone. Across the country and around the world, we're seeing rising numbers of COVID-19 cases. This was the main focus of my calls with President-elect Biden and Prime Minister Johnson yesterday. With rising cases of COVID-19 here at home, there's added pressure on all orders of government to keep people safe and to protect jobs. But I would hope that no leader in our country is easing public health vigilance because they feel pressure not to shut down businesses or slow down our economy. I understand that worry, but let me tell you, that's how we end up with businesses going out of business and the economy damaged even more. Beating COVID is the only way to protect our economy. Yes, we have great news of possible vaccines on the horizon, but a vaccine later won't help you or your family if you get sick now. The federal government is here to help your communities. We are providing unprecedented direct support to those businesses impacted by any shutdown orders. We are there for workers who lose hours, who lose their job. It's tough, but I know we can get through this. We're seeing record spikes this morning across the country. So I urge the premiers and the mayors to please do the right thing. Act now to protect public health. If you think something is missing in the support we're offering your citizens, tell us. We will work with you as we have since day one. The federal government promised to have Canadians' backs, and we will, whatever it takes, for as long as it takes. We all know the virus is surging. So once again, I'm asking all Canadians to please follow your local public health guidelines. Wash your hands, wear a mask, keep a safe 2 meters distance from each other, and download the COVID Alert app. Together, we will get through this. Au cours des derniers jours, le Canada a enregistré un nombre record de cas et la situation nous préoccupe beaucoup. Le virus se propage rapidement et c'est pourquoi on doit continuer nos efforts. Alors, s'il vous plaît, suivez les conseils de vos autorités de santé publique. Lavez-vous les mains, portez le masque, gardez une distance sécuritaire de 2 mètres avec les autres et téléchargez l'application gratuite Alerte COVID. C'est en travaillant ensemble qu'on va passer au travers de cette crise. Job one right now is keeping people safe. So whether it's by buying more PPE or helping to ramp up testing, that's what our government is focused on. Over the past few days, we've provided over 1.2 million pairs of nitrile gloves to workers on the front lines, with millions more to come. We've also provided over 3.3 million rapid tests to the provinces and territories, with more on the way. And to ensure that we have as many resources as possible, Health Canada approved another rapid test, the BD Veritor. This is a handheld device that can process a test in just over 15 minutes. Canada has a contract for 7.6 million of these tests overall, with millions arriving before the end of this year. We expect delivery to start in the next few weeks. À ce jour, nous avons fourni plus de 3,3 millions de tests de dépistage rapides aux provinces et aux territoires, et plusieurs autres suivront. Et pour assurer notre accès au plus grand nombre de ressources possibles, Santé Canada a approuvé un autre outil de dépistage rapide, le BD Veritor. Il s'agit d'un appareil portatif qui peut effectuer un test en un peu plus de 15 minutes. Le Canada a conclu une entente pour obtenir 7,6 millions de ces tests au total, avec la livraison des premiers millions prévus pour les semaines à venir. Finding a safe, effective vaccine is vital to stop the spread of COVID-19. That's why we've secured millions of doses of potential vaccines from the world's leading vaccine manufacturers and therapeutics. Right now, scientists and companies are working around the clock, and just yesterday we heard promising news from Pfizer and BioNTech's vaccine candidate. Canada signed a deal to secure millions of these doses back in August, adding to our diverse portfolio of potential vaccines and therapeutics. We will continue to support researchers and scientists in the weeks and months to come. Hier encore, on a reçu des nouvelles encourageantes concernant le candidat vaccin de Pfizer et BioNTech. En août, le Canada a signé un accord pour obtenir des millions de doses de ce vaccin qui fait partie de nos options diversifiées de vaccins potentiels. Nous allons continuer de collaborer avec les scientifiques et lorsqu'un vaccin sera approuvé, nous allons être prêts. Since the start of this pandemic, we've seen Canadian companies step up to make personal protective equipment. And as a part of our Made in Canada plan, we've been supporting businesses like General Motors in Oshawa to do just that. So far, they've made nearly 5 million masks for people right here at home. These masks are made by Canadians for Canadians. And the production of these essential pieces of PPE are creating good jobs. On that note, the newly ratified agreement between GM and Unifor is great news for workers and for our auto industry in Canada. I spoke with Mary Barra, the CEO of GM, yesterday, and we're both excited about what our future collaboration could bring. This agreement brings up to 1,700 new, good-paying jobs in Oshawa while securing jobs in St. Catharines and Woodstock. This is a vote of confidence by industry leaders in Canada's economy. Our government will continue to work with our partners to ensure that Canadians get good jobs they can rely on. I want to end this morning by taking a moment to recognize that tomorrow we will mark Remembrance Day. Canadians would normally gather at cenotaphs across the country to pay tribute to those who fought for our freedom. People would gather at local Royal Canadian Legions to thank the heroes who kept this country strong and free. But this year will be different. COVID-19 means many ceremonies are online. Many veterans are staying at home. And too many of the legions that provide support for them are facing tough times themselves. Our veterans served Canada with honor and valor. They stepped up for us, and now we must step up for them. So today, I can announce that the Government of Canada is providing $20 million to create the new Veterans Organizations Emergency Support Fund. This fund is designed to help veterans organizations keep providing services. Over $17 million of the funding will go to the Royal Canadian Legion, ANAVETS, True Patriot Love, and Vets Canada. The remaining amount is available through application to other veterans organizations that have been affected by COVID-19. Minister MacAulay will have more to share on this in a few minutes. But to the women and men who've served our country, I want to say this. You represent the best of who we are, and we will forever be in your debt. And to all those who bravely serve today, thank you for everything you do. Aujourd'hui, j'annonce que le gouvernement du Canada va investir 20 millions de dollars dans la création du Fonds d'urgence à l'appui des organismes de vétérans. Ce fonds est conçu pour aider ces organismes à continuer de fournir des services pour soutenir ceux qui ont été touchés par la crise. Cette semaine, même si on ne peut pas se rassembler comme on a l'habitude de le faire, on peut toujours montrer notre soutien à nos anciens combattants en portant un coquelicot et en regardant les cérémonies du jour du souvenir en ligne. J'encourage les Canadiens à rechercher le mot-clic « Le Canada se souvient » sur les médias sociaux pour lire des récits de services et de sacrifices à propos de nos braves femmes et hommes en uniforme. En vue du jour du souvenir, rendons hommage à nos anciens combattants qui nous ont tant donné et à nos militaires qui continuent d'être là pour nous. Merci. Je passe maintenant la parole au ministre MacAulay. Lawrence.
Thank you very much, Prime Minister, and good morning. I'm so pleased that the Government of Canada is providing $20 million to veterans organizations that have been hit so hard by the pandemic. The last few months have been rough on folks, and our veterans are certainly no different. It's been a tough time for them, but it's also been a tough time on the organizations that support them. The newly created Temporary Veterans Organization Emergency Support Fund will help veterans organizations access money to address the shortfalls caused by the pandemic. Legion branches will apply for funding through the Legion's Dominion Command. ANAVET's branch will apply through their Dominion Command. Other organizations can apply for funding through our website at veterans.gc.ca. These organizations provide essential service and make a real difference in the lives of our veterans and their families. They also play a critical role in their communities, including by supporting homeless and disabled veterans. As I said, veterans have been hit hard by this pandemic. Some are at risk because of their age and declining mental and physical health. Others are more vulnerable because of homelessness or because they are now in long-term care homes. But that's what makes the works of these organizations so important. The Legion, ANAVETS, Through Patriot Love, Vets Canada, and all the others who will be receiving funding. These organizations change lives and they save lives. And above all, they're there when our veterans need them. The Veterans Organization Emergency Support Fund is there to make sure that we can continue to be there for them now and in the future. We owe a lot to our veterans. Their legacy is a legacy of service and sacrifice that we could all do well to remember at times like this. They were there for us, and we will continue to be there for them. Thank you.
Thank you. Thank you, Lawrence. Good morning, everyone. With tomorrow being Remembrance Day, our thoughts turn to our veterans and their families, to those who served and continue to serve our country. Thank you for seeking a more peaceful world. We are so grateful. Today, I would like to provide you with a brief update on our procurements. We continue to procure PPE, personal protective equipment. We have procured more than 2 billion items of PPE as a result of the long-term contracts that we have put in place in anticipation and preparation for a potential second wave. En plus d'obtenir de l'équipement de protection individuelle, d'autres fournitures et éventuellement un vaccin sûr et efficace, nous continuons d'accueillir des tests dépistage rapide pour aider les provinces et les territoires à réduire la propagation du virus. Alors, aujourd'hui, la ministre Haïdou et moi-même annonçons que notre gouvernement a signé une entente avec Becton Dickinson de l'Ontario en vue d'acheter près de 7,6 millions de ces tests de détection antigène BD Veritor et près de 2,200 analyseurs. These tests, which have been approved by Health Canada, can provide results in as little as 15 minutes with a nasal swab. We expect to begin taking delivery of the Becton Dickinson tests later this month, at which point the Public Health Agency of Canada will deploy them to provincial and territorial counterparts to support their COVID-19 testing regimes. I would also like to provide an update on the delivery of Abbott's ID Now and PanBio tests previously announced. To date, in excess of 3 million of these rapid tests have already been delivered to the provinces and territories for use in their jurisdictions. Deliveries are continuing on a weekly basis. These tests will play an important role in helping Canada to cope with rising case numbers and will supplement the existing standardized testing regime. Nous nous préparons aussi au moment où un vaccin sera disponible. Service public et approvisionnement Canada a lancé une invitation à se qualifier en vue de trouver un ou plusieurs fournisseurs capables d'offrir une solution logistique complète qui permettra la distribution physique des vaccins aux autorités provinciales et territoriales ou aux points d'administration. 70 companies participated in PSPC's recent bidders conference, ranging from cargo airlines to couriers and healthcare supply companies to cold chain experts. The logistics associated with vaccine procurement and distribution are complex, especially in light of the need to transport and store vaccines at specific temperatures, which can vary depending on the vaccine itself. We are moving quickly to put these logistical arrangements to ensure that when a vaccine is ready, Canada will also be ready. En terminant, n'oublions pas de veiller à la sécurité de chacun et soyez assurés que le gouvernement du Canada sera là pour vous soutenir et vous aider à rester en santé et en sécurité tout au long de cette pandémie. Thank you, Miigwech. Merci beaucoup.
Good afternoon. Bonjour à toutes et à tous. There have been 268,735 cases of COVID-19 in Canada, including 10,564 deaths. Nationally, there are close to 40,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 55,000 people daily, with 5.8% testing positive. Yesterday, 4,086 cases were reported nationally. In addition, there were close to 9,000 new cases reported for Saturday and Sunday. This brings the average daily case count to over 3,800 cases for the past week. The number of people experiencing severe illness is also continuing to increase. Over the past 7 days, there were on average over 1,300 individuals with COVID-19 being treated in Canadian hospitals, including almost 250 in critical care, and an average of 51 deaths were reported each day. With the continued increase in daily cases, percentage of people testing positive, and still rising numbers of people being treated in hospitals across the country, it is clear we have yet to bend the curve on accelerated growth in Canada. Now, as our activities move indoors during the colder weather, providing even better opportunities for the spread of respiratory viruses, it's time to get really serious. Going into this respiratory season, COVID-19 is already well ahead of us. Outbreaks continue to contribute to COVID-19 spread in Canada and are being reported in a range of settings, including long-term care and assisted living facilities, schools, congregate living settings, industrial work settings, and social gatherings. To get the better of an opportunistic virus that spread through everyday interactions, when infected people talk, sing, shout, cough, or sneeze, we need to avoid the 3C settings and situations: closed spaces, crowded places, and close contact situations that give it an advantage. We also know that prevention practices we need to do to get ahead of the virus, layering on our protections is the key, and nobody knows layering like Canadians in winter. We start with the most important decision. Stay home and self-isolate if you have any symptoms. Add on an essential base layer of 2-meter physical distancing and frequent hand, cough, and surface hygiene. Finally, we top it off with a protective outer layer of a non-medical mask or face covering when in public or any indoor space where there are people from outside your immediate household. Tomorrow marks Remembrance Day, when we honor those who have served Canada in the past and present, in times of war, military conflict, and peace. While we may not be able to come physically together this year to commemorate their courage and sacrifice in person, I know we are one in holding them in our thoughts. Together, we remember, and together, we can do hard things. Thank you.
Bonjour à toutes et à tous. Il y a eu 268 735 cas de COVID-19 au Canada, dont 10 564 décès. Il y a près de 40 000 cas actifs au pays. Au cours de la dernière semaine, les laboratoires de l'ensemble du pays ont analysé les tests de dépistage de près de 55 000 personnes par jour en moyenne, dont 5,8% ont reçu un résultat positif. Hier, 4 086 cas ont été signalés au pays. De plus, près de 9 000 nouveaux cas ont été enregistrés samedi et dimanche, ce qui porte le nombre moyen de cas signalés quotidiennement à plus de 3 800. Le nombre de personnes présentant des symptômes graves continue également d'augmenter. Au cours des 7 derniers jours, on a dénombré en moyenne plus de 1 300 personnes atteintes de COVID-19 dans les hôpitaux canadiens, dont presque 250 aux soins intensifs et 51 décès par jour. Comme on continue de voir une augmentation du nombre de cas quotidiens, du pourcentage de personnes qui reçoivent un résultat positif et du nombre de personnes qui sont traitées dans les hôpitaux au pays, il est clair que nous n'avons pas encore ralenti la croissance de la courbe au Canada. Maintenant, comme nous exerçons plutôt nos activités à l'intérieur quand il fait froid, ce qui favorise encore plus la propagation du virus respiratoire, il est temps de prendre les choses au sérieux. Alors que cette période des infections respiratoires commence, nous luttons déjà contre la COVID-19. Les éclosions continuent de contribuer à la propagation de la COVID-19 au Canada et sont signalées dans divers milieux, notamment dans les établissements de soins de longue durée et les résidences-services, les écoles, les établissements d'habitation collective, les milieux de travail industriels et les rassemblements sociaux. Pour avoir raison d'un virus opportuniste, qui se propage dans le cadre des interactions quotidiennes lorsque les personnes infectées parlent, chantent, crient, toussent ou éternuent, nous devons éviter les becs, les lieux bondés, les contacts étroits, les espaces clos. De même que les situations qui procurent au virus un milieu propice. Nous connaissons aussi les mesures de prévention à mettre en pratique pour ralentir la propagation du virus. L'application de couches de protection est la clé. Et personne d'autre ne sait mieux que les Canadiens ce qu'on entend par l'application de couches en hiver. Nous commençons par la décision la plus importante, rester à la maison et nous auto-isoler si nous avons des symptômes. Nous ajoutons à cela une couche de base essentielle, distanciation physique de 2 mètres, hygiène fréquente des mains, étiquette respiratoire et hygiène des surfaces. Pour terminer, nous ajoutons une couche de protection extérieure, masque non médical ou couvre-visage lorsque nous sommes en public ou dans un espace intérieur avec des personnes n'appartenant pas à notre ménage immédiat. Nous soulignons demain le jour du souvenir afin d'honorer les personnes qui ont servi dans le passé et qui servent actuellement le Canada, en temps de guerre, de conflits militaires et de paix. Nous ne pourrons pas nous réunir physiquement cette année pour célébrer leur courage et leur sacrifice personnel, mais je sais que nous sommes unis et que nos pensées les accompagnent. Ensemble, nous nous souvenons et ensemble, nous pouvons accomplir des choses difficiles. Merci.
Thank you, Doctor. We'll now turn to the phone for questions. After a number of questions on the phone, we'll return to the room. Operator?
Thank you. Merci. Première question, Hélène Buzetti, Le Devoir, à vous.
Oui, bonjour, Monsieur Trudeau. Aujourd'hui, Radio-Canada nous apprend qu'à cause de la pandémie, Ottawa vide les centres de détention de migrants. Alors, la question, la population devrait-elle craindre pour sa sécurité? Et si la réponse est non, que ces gens-là ne sont pas dangereux, alors pourquoi les emprisonne-t-on?
D'abord, la santé et la sécurité de tout le monde est toujours une priorité pour nous. La décision a été prise d'utiliser des centres alternatifs plutôt que les centres de détention, qui sont toujours une mesure de dernier recours de toute façon. The health and safety of everyone is always a priority for us. Detention centers, from immigration detention centers, are always used as a last resort, and the decision has been made by CBSA to use other facilities rather than detention centers.
Une suivi, Hélène?
Oui. Oui, mais je crois comprendre aussi que certaines personnes sont renvoyées dans la communauté. Alors, si on peut le faire parce qu'il y a une pandémie, pourquoi est-ce qu'on ne le fait pas tout le temps? Merci.
Je pense qu'une des choses à laquelle on est toujours en train de réfléchir dans cette pandémie, quand on fait des choses différemment, qu'on réfléchit à la meilleure façon de faire les choses, il y a des choses qui vont nous apprendre à réfléchir aux prochaines étapes, à ce qu'on pourrait faire dans l'avenir, parce qu'on le fait dans cette situation-ci. Il y a bien des systèmes qu'on va examiner dans les mois et les années à venir pour voir si on peut les améliorer, étant donné ce que nous avons tous vécu maintenant. I think it's perfectly natural that with all the different things we're doing in less ordinary ways during this pandemic, that it gives us pause and allows us to reflect on maybe we can do things differently or better into the future. I think there's a number of things that we'll be looking at within our systems that we may make changes to. Right now, however, we're very much focused on fighting this pandemic.
Merci. Prochaine question. Operator?
Merci. Prochaine question, Raymond Filion, TVA, à vous.
Merci. Bonjour, Monsieur le Premier ministre. Vous avez dit dans votre discours il y a quelques minutes que vous implorez les premiers ministres et les maires de faire la bonne chose, d'agir maintenant pour protéger la santé publique. Pourquoi sentez-vous le besoin de lancer cet appel-là aujourd'hui? Est-ce que c'est parce qu'à vos yeux, il y a des maires, des premiers ministres qui ne prennent pas les mesures qui s'imposent? Vous craignez un relâchement des restrictions trop vite?
Bien, on voit évidemment qu'il y a une montée importante des cas à travers le pays et on voit aussi, et on sait aussi par expérience que d'agir rapidement pour protéger la santé publique, c'est la meilleure chose à faire et pour protéger les citoyens et pour protéger l'économie pour les mois et les années à venir. Le gouvernement fédéral a pris les mesures nécessaires pour être là, pour appuyer les travailleurs, les familles, les entreprises qui doivent changer leur comportement ou fermer à cause de cette pandémie. Et c'est pour donner la capacité aux décideurs locaux et régionaux d'agir rapidement pour protéger la santé des gens, sachant que le gouvernement fédéral va être là pour protéger l'économie. On sait qu'il faut agir rapidement et c'est ce qu'on encourage toutes les provinces et les autorités régionales à faire. I think we're seeing a significant rise in cases across the country. And we know that people are trying to balance a time where people are getting tired and frustrated by COVID-19. But we also know that the best thing to do to protect not just the health of Canadians, but the health of our economy into the medium and long term is to do what is necessary to keep people safe from COVID right now. But in order to make those decisions easier for local and provincial public health authorities, the federal government has continued to step up. We're there with direct supports for families. We're there with direct supports for workers. We're there with direct supports for businesses, including extra top-ups for businesses that are forced to close because of local public health directives. We at the federal government are making it easier for provinces to do the right thing and shut down and put in restrictions so that we can control the spread of COVID-19. We see vaccines on the horizons, but we are not there yet. We need to make it through this winter. And in order to do that, we have to put the health of Canadians first, which is also the way to put the economy first, because we know if businesses continue to suffer under surges of COVID-19, the damage will be longer lasting than targeted shutdowns and federal financial supports.
Une suivi, Ray?
Ouais, deux questions suivies. Un, est-ce que vous voyez des manquements au niveau local? Et deux, j'aimerais que vous reveniez sur les défis que pose la distribution du vaccin Pfizer. Vous en avez parlé hier, là, avoir entrepris des démarches. La ministre Anand en a glissé un mot. Très peu de compagnies ont les ressources pour entreposer à moins 75 degrés. Alors, quel est le plan concret? Est-ce qu'Ottawa songe, par exemple, à acheter des réfrigérateurs, des congélateurs capables de faire ça?
D'abord, pour la première question, on est là pour répondre aux besoins locaux. On est en train de demander aux communautés, aux municipalités, aux provinces, est-ce qu'il y a plus qu'on peut faire en tant que gouvernement? Est-ce qu'il y a plus qu'on a besoin de faire pour les aider à prendre les bonnes décisions, pour protéger les citoyens? Nous travaillons ensemble depuis les débuts de cette pandémie. Nous allons continuer d'être là et on demande justement s'il y a plus qu'on peut faire pour aider les autorités locales à prendre les bonnes décisions rapidement. Par rapport au vaccin Pfizer, effectivement, il y a des exigences logistiques assez complexes. On doit garder le vaccin à moins 75 degrés Celsius. C'est tout un défi pour distribuer, transporter des vaccins à cette température-là. C'est pour ça qu'on est en train de développer un plan concret. On sait que c'est un vaccin parmi plusieurs autres. Ils n'ont pas tous ces exigences-là. Alors, c'est logique qu'en regardant la façon qu'on peut utiliser et assurer l'utilisation la plus efficace de ce vaccin, on va avoir des conversations avec les provinces, avec les régions sur la meilleure façon d'assurer une distribution rapide et efficace aux personnes prioritaires de ce vaccin.
Thank you. And we'll take one more call on the phone, please. Operator.
Thank you. Merci. Next question, Ryan Tumulty, National Post, line open.
Yeah, sir, you're calling on provinces and mayors to do the right thing with regards to the COVID restrictions. I'm wondering if you can define what you view as the right thing. And also, you've been hesitant. You said you won't invoke the Emergencies Act to take that decision away from them. Is there a point at which you would change that stance and have the federal government step in and impose these restrictions?
From the very beginning, we have worked extremely well with the provinces and territories to ensure that Canada has had good success despite all the tragedy and loss in managing COVID-19. We are in the middle of a very concerning spike right now that is lining up with the arrival of winter as people are going to go inside, and we know that poses real challenges. Our responsibility as a federal government is to be there to support Canadians as we move forward and to directly support provinces and territories as they make the decisions that are right for their territories. But we know from watching the course of the virus around the world and in other jurisdictions that acting quickly to shut down early, to bring in restrictions when the surges start is better than delaying and hoping that it'll go away on its own. That's why we've made those decisions easier for provinces and territories by being there with financial supports for workers, for families, for businesses that are facing tough times because of COVID. Because we all want things to get back to normal. And if businesses go under because of the COVID-19 pandemic surges, we end up worse off in the recovery. We want people to be able to hold on through this challenge. That's why we're there directly to support businesses and people right across the country. And that's why we certainly encourage the provinces to act quickly to control the spread of this virus with the measures that increasingly scientists and experts around the world are agreed are effective. Targeted shutdowns, limits where necessary. We're seeing Europe right now that went through a bit of a loosening over the summer, perhaps more than they should have, now having to bring in far more restrictions than even now we're looking at in the hardest hit parts of this country. So there is a way of acting quickly to prevent challenges further down the line. And as a federal government, we're there to support the provinces who make those decisions by directly supporting their citizens. Okay. Nous savons que d'agir rapidement et avec fermeté pour fermer certains endroits, pour mettre des limites à d'autres, c'est la meilleure façon de contrôler des éclosions de la COVID-19. On l'a vu, par exemple, en Europe, où ils ont tardé un petit peu à refermer dans la deuxième vague et sont en train de vivre des moments et des restrictions assez difficiles. Si nous, on peut éviter, en apprenant de la leçon des autres et en agissant rapidement, ce serait mieux, pas juste pour la santé des gens, mais pour l'économie aussi. Mais c'est pour ça que le gouvernement fédéral a pris la décision dès le début d'être là pour appuyer directement les citoyens, les entreprises, les communautés qui en ont besoin, les organismes sans but lucratif qui aident les autres. On a été là directement pour les aider, pour permettre justement aux autorités locales de santé publique de prendre la bonne décision et d'amener et d'imposer des restrictions pour justement permettre de contrôler ces éclosions sans faire souffrir l'économie au long terme. Pour pouvoir passer à travers de cette pandémie, pour pouvoir avoir une économie qui revient en force, il faut qu'on contrôle l'éclosion de la COVID-19. Et c'est pour ça que le gouvernement fédéral est là pour appuyer les gens qui doivent fermer à cause d'ordre public.
Follow-up, Ryan?
Yeah, so just on the other half of my question about the Emergencies Act, you said that Premier should be acting at the start of the surge, which so far they haven't done. In Ontario, we're even loosening restrictions as the surge continues. Is there a point at which you would consider invoking that act and having the federal government make those choices?
I've had over 20 conversations with the First Ministers directly, 20 First Ministers meetings since the beginning of this pandemic. The issue of the Emergencies Act has come up a number of times, and I've continued to reassure them that I don't see it as being necessary right now. I know that all Canadians are united in wanting to fight this pandemic. I know that all premiers are thinking about the health of their citizens as well as they think about the health of their economy. And that's why I'm confident we're going to be able to continue to work together well and do the right things. Okay. On a, depuis les débuts de cette pandémie, eu une vingtaine de rencontres des premiers ministres et on a toujours très bien travaillé ensemble. Il y a eu des discussions sur la loi sur les mesures d'urgence au printemps et je les ai assurés à ce moment-là et je peux continuer de les assurer que je ne pense pas qu'on a besoin d'utiliser des mesures d'urgence. Je pense qu'on travaille très bien ensemble et que nous allons continuer de travailler très bien ensemble pour protéger les Canadiens, ce que nous voulons tous.
Morning, Mia Rabson from the Canadian Press. I'm just curious, in your conversation with President-elect Biden this week, did you discuss the ongoing confusion or uncertainty being placed on these election results happening in the United States? And also, if you have any unfinished business with the current president that you intend to tackle before he leaves office?
I had a very good conversation with President-elect Biden yesterday in which we addressed issues particularly around COVID-19, which is the great issue of our time, but a number of other issues as well. As I said from the beginning, it is not my role to be weighing in any fashion into American electoral processes. My job is to stay focused on Canadian interests and our interests around the world, and that's what I did.
Good morning, Prime Minister. Tonda McCharles, Toronto Star. Could you address the vaccine distribution plan that you have and the logistical challenges that you've referenced? The U.S. has Operation Warp Speed. They've got the Army in charge. They've got a plan they're going to deliver from point A to point B. They've spent $12 billion on it already. We seem to be in contracting purgatory. We still haven't actually contracted anyone to do that. So can you speak to how you're going to do that? You want to roll out vaccines by January. How's that actually going to happen?
We've known from the very beginning that vaccines represent our best chance of getting through and beyond this COVID-19 pandemic. That's why from the summer, we've been working on signing contracts with potential vaccine creators around the world. Canada is one of the best positioned countries in terms of portfolio of vaccines. But it's not simply enough to have a vaccine discovered. It's not simply enough to have doses of those vaccines secured, and we have millions of doses of potential vaccines. We have to get them into people. We have to get them into people's arms. And if that's indeed the way that each vaccine gets delivered, there's a lot of variability. But in order to do that, we've been working since the summer on a comprehensive plan for distribution, recognizing that different vaccines will have different requirements. Some can be kept at room temperature, some need to be kept at -75, and there's a huge range of complexity around them. So the entire framework around distribution and delivery of those vaccines is very much being worked on. And I can turn to Minister Anand, and hopefully she will have a better sound connection than she had earlier to follow up on the plan for distributing these vaccines.
Yes, thank you, Prime Minister. Tonda, thanks for your question. In fact, we have been engaged in the planning for the administration and distribution of vaccines for many months, alongside of our vaccine procurements. And the way I think we should think about this is that, yes, it's a very complex process, but just as we did with our procurements of PPE, we will ensure that there is an effective and efficient vaccine distribution system in place. In particular, we need to think about 4 different stages of this vaccine distribution process. First of all, the regulatory process. Ensuring that vaccines are delivered to people is going to be contingent upon Health Canada approval. We already know that Health Canada has begun a rolling review of 3 candidates, Pfizer, Moderna, and AstraZeneca. We have also invested $173 million in Medicago's development in Canada to ensure that there is a Made in Canada solution going forward as well. The next stage, biomanufacturing, is also important. We've invested in the NML's Royal Mount facility, as you know, to bolster domestic biomanufacturing capacity, to complete fill and finish, the final step in vaccine production, which may be required for some vaccines. Our investment is going to be very important. Alongside of that are contracts for 3 fill and finish machines procured from Burnaby's Van RX, and we're looking at additional domestic options to build fill and finish capacity. The third phase, distribution, we should note that the Public Health Agency of Canada, and I'm sure Dr. Tam will have items to add afterwards, PHAC is actively engaged in agile procurement for vaccine logistics. And in particular, my department of PSPC has issued an LOI and have heard from more than 70 companies already, ranging from cargo airlines and couriers to healthcare supply chain companies and cold chain experts. And we are working always with the provinces and the territories to ensure a seamless distribution system is established. And along that line, fourthly and finally, we have the administration of the vaccine itself. And again, contracts have been in place, Tonda, for some time. We've procured the supplies necessary for COVID-19 vaccines, including 90 million syringes and 100 million needles from Becton Dickinson, Sharps containers, 90 million alcohol swabs, 75 million bandages and gauze strips, and 90 million alcohol swabs from Cardinal Health. So by all means, our logistics operation is moving very well. We are going to establish in a very complex environment an efficient and effective distribution system for these vaccines once they are approved by Health Canada.
Kevin Gallagher, CTV, Prime Minister. Remembrance Day is tomorrow, but nearly 19,000 disabled veterans are currently sitting in a backlog, and they're upset, saying that if clearing this was a top priority for the government, it would have already been done. So what's taking so long? And Minister MacAulay, if you'd like to weigh in as well, feel free.
Since we took office over the past 5 years, we've invested more than $10 billion in new money in supporting veterans and their families. We know there is always more to do, but we have worked significantly to reduce veterans' backlogs, to reopen the 9 shuttered offices that were closed under the previous Conservative government, to be there for veterans in expanding services for their families, including mental health and PTSD investments. There is always more to do, but we will continue to stand by our veterans this week and all weeks as we recognize their service, their sacrifice, and that the country we now live in and cherish is due to so many of their efforts. Lawrence.
Thank you very much. And one of the facts that's important to note is, number one, the financial aspect. There was a lot of money put in, but there's also a 90% increase in first applications to Veterans Affairs. So, of course, that increases. It's very difficult to predict what takes place because we, at Veterans Affairs, we have no control on who will apply for a disability or whatever. But we have to make sure that we have the system in place. And without a question, we did that because with the $10 billion first initial investment, and then just previously $200 million, just under $200 million to address the backload alone is so vitally important. And with that, we're changing, like if you deal with an application, everybody that's dealing with that application is in one area. It doesn't have to be sent to one area or the other. We're digitizing the files to make sure that you push a button and find as quickly as possible. All this takes time. We hired 350 new employees. They're now being educated for this specific reason. So without any doubt, it's going to take some time, but we are certainly going to address the backlog. Thank you.
Hi, Prime Minister. Tom Perry with CBC. Your MP, Yasmin Ratansi, has left caucus. It came out that she hired her sister to work in her office. You had another MP, Marwan Tabara. He was forced out over criminal charges. So I'd like to get your response first in the case of Ms. Ratansi. When did you find out about it? What do you think should happen? But more broadly, do you think you've got a screening problem? Why do you have these MPs who, for one reason or another, have to leave caucus?
First of all, I am deeply disappointed by the news I learned yesterday from Ms. Ratansi and how she handled the office. It is unacceptable, and I expect there to be a thorough follow-up by the House administration on this. We have an extraordinary group of MPs in the House of Commons in all parties who have dedicated themselves to serving their communities and serving their country. And we need to know that there are strong rules in place to ensure that they behave properly, and we always expect the very best of all of them in our party and in all parties, and we will continue to hold that high standard. Okay. Évidemment, j'ai été extrêmement déçu d'apprendre hier de ce que Mme Ratansi a fait sur de longues années. Je sais que la Chambre des communes va faire un suivi sur ce qu'elle a fait et va prendre les étapes, va entreprendre les étapes nécessaires. Mais je veux que les gens se souviennent que dans tous les partis sont composés, la Chambre des communes est composée de députés qui se dévouent à leur communauté, qui se dévouent au service de leur pays, de différents partis. Et il y a des règles à suivre et vaste majorité de tous ces députés suivent ces règles-là. Ils sont des gens extrêmement honorables qu'on se doit de reconnaître pour leur sacrifice et leur dévouement à leur communauté. Et c'est décevant quand des événements comme ça surgissent qui ternissent la réputation de 338 députés.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. C'est fort ce que vous avez dit tantôt. Vous avez dit aux maires puis au premier ministre des provinces, agissez pour protéger la santé publique. Je veux comprendre ce qui motive cette intervention-là de votre part aujourd'hui, de sortir aussi fort. Qu'est-ce que vous voyez qui vous inquiète tant? Est-ce que c'est la réouverture des bars en Ontario? Est-ce que c'est la résistance en Alberta et au Manitoba de peut-être fermer certains commerces? Pouvez-vous être spécifique, s'il vous plaît?
On est en train de voir une résurgence très forte de la COVID-19. On voit des cas records dans des juridictions qui pourraient en faire plus pour amener des règles et limiter l'expansion et l'éclosion de la COVID-19. Le gouvernement fédéral n'a pas la responsabilité de dire dans chaque région qu'est-ce qu'il devrait faire, comment il devrait gérer l'éclosion de la COVID-19. Mais on est là pour dire, on va rendre la tâche plus facile, on va rendre un choix difficile, moins difficile, en disant que si vous avez besoin de fermer, si vous prenez la décision de fermer rapidement et de limiter certaines institutions, certaines entreprises, certains comportements, on va être là pour appuyer directement les citoyens, pour appuyer directement les commerces, les entreprises qui doivent fermer ou limiter leurs heures. On va être là pour pouvoir passer à travers, parce que la meilleure façon de protéger notre bien-être économique pour les années à venir, c'est de contrôler maintenant l'éclosion de la COVID. On n'est pas en train de faire des faveurs aux entreprises en essayant de garder plus ouvert longtemps quand on voit les cas continuer à augmenter. C'est de pas bien servir nos communautés, nos citoyens ou notre économie. C'est pour ça qu'on est là pour continuer d'être là, continuer d'appuyer directement les familles, les entreprises, comme on l'a fait depuis le début.
Can I just get the English bit at the top part of that question? Lou was asking about Ontario, Alberta, just that top bit.
I think it's extremely important to recognize that we are in a resurgence of COVID-19. And there are things that different regions can do more to fight COVID-19. And our job as a federal government is to be there to make difficult decisions slightly less difficult. Knowing that if there is a decision to shut down certain businesses or limit certain activities, we will be there as a federal government with direct supports for workers, for families, for businesses, for business owners, so we can get through this pandemic. The only way to ensure our economy will be strong next summer and the years after that is to hold on through this pandemic and make our top priority fighting COVID-19, doing what we need to do right now. The federal government doesn't decide who closes down where and how fast. But what we have done is made it easier for provinces to do the right thing, knowing that those direct federal supports for workers, for businesses, for families are going to continue to help us get through this as a family and as a country.
David Aiken, Global News. Just to switch topics, we've seen some new medical research now that suggests that those who have COVID, those who are diagnosed with COVID, much more likely to experience some mental health problems. So along those lines, knowing that sometimes it costs money to be able to get mental health treatment, we've got payments in place for caregivers, seniors, disabilities. What about a one-time benefit payment then for those who are required to take on some new mental health treatments? Is there a possibility you guys have some money for that?
From the very beginning of our first mandate, as a government, we recognized the need to invest in mental health services, and we invested $5 billion for the provinces to stand up and provide more mental health supports. Through this pandemic, we've invested in organizations like Kids Help Phone and United Way and various support organizations who are there to support Canadians struggling. And we're going to continue to work with provinces to ensure that they're able to deliver the kind of medical care right across the country to all Canadians that we need. Mental health challenges are certainly a really important part of what we're all dealing with right now. And the federal government will continue to be there to work with provinces on delivering the best mental health care possible.
Thank you. That concludes the questions for the Prime Minister. The doctors and the ministers will stick around for a little bit longer, but we'll go to the phone for questions first. So, operator, next question, please.
Thank you. Merci. Next question, Steve Shear, Reuters. Line open.
Hello. This is a question for Minister Anand. In the United States, the Department of Health and Human Services has said it expects to have enough doses of the coronavirus vaccine for all Americans by March or April. Yesterday, there was talk about, the Prime Minister talked about having enough doses perhaps of the Pfizer vaccine for high priority groups in Canada in the first quarter. But when do you expect all Canadians to have access to a vaccine?
Well, thank you for the question, and it does allow me to highlight the aggressive procurement stream that we have undertaken over the last number of months in the interests of the health and safety of Canadians. Through our procurements, we have ensured that we will allow Canadians access to a minimum of 194 million doses and a maximum thus far of 414 million doses if you include the options that we have negotiated. So these aggressive negotiations have indeed placed Canadians in very good stead as the vaccines reach their phase 3 clinical trials successfully and if they are indeed approved by Health Canada. We expect deliveries in the first part of 2021, and these delivery dates are in line with the European Union, Ireland, Japan, Australia, and New Zealand, and many other countries. So basically, this is the strategy of our vaccine procurements, and as I outlined in my response to Tonda, we are also having to put in place a very complex vaccine logistics and distribution program, which is well underway and very, very focused on the efficient and the secure distribution of vaccines for Canadians, because that is our priority. That is what we will continue to work on, and we will not rest until it is finished.
Follow-up, Steve?
You didn't really say whether you didn't predict any sort of date for next year. Can you be any more specific as to when 38 million Canadians will have access to a vaccine? Do you have any timeline on that?
So in order to provide you with the context here, we have 7 agreements in place. We have millions of doses being procured for Canadians. And with each of the suppliers, we are negotiating hard in terms of delivery dates. And so it is impossible for me to isolate one single date because of the magnitude of the number of doses under negotiation. But we are very well placed to have these vaccines into Canada, contingent on Health Canada approval, of course, in the first part of 2021.
Thank you. And next question, operator.
Thank you. Merci. Next question, Jolson Lim, iPolitics, line open.
Hi, Ministers. Thanks so much for taking our questions. This one's for Minister MacAulay. Few veterans have applied for the disability benefit during the pandemic. Will funding from today's announcement be used to help more veterans access government support during this time? And generally, what's being done to make it easier for veterans to access benefits during this difficult time?
Thank you very much. And yes, in fact, it indirectly will, because the Legion, the Anavets, the True Patriot Love, and Vets Canada, they all work hard with veterans organizations in order to, let's say, put together applications for disability benefits. All this kind of work is done through these organizations, and that's why it's so vitally important that the organizations have the funding. That's one part of what they do, but they do many other things too, dealing with homeless and emergency situations and a lot of other things. But yes, it will help.
Follow-up, Jolson?
Yes, and how soon, if there's a timeline available, can we expect the backlog to significantly shrink? And what do you say to veterans who are less disappointed by your government on this?
Well, yes, in fact, this process has started. The organization in the department is like groups dealing with applications. You don't have to send the application to one area to another. That has also helped, and there's been digitization. We're working on digitizing the files, and with that, in fact, it's come down slightly already, but we want to be careful. But we have 350, as I said, employees that have been hired that are trained to deal with these files. So putting all this together, we're very hopeful to have on 2022 to have. We don't expect we're going to totally eliminate the backlog, because there are cases that are difficult to deal with, and we have to make sure that the veteran receives the appropriate compensation for the injury they have. But in general, by 2022, we feel that these changes and the new employees will have a major effect on the backlog. Thank you.
CTV, Dr. Tam, back in August, Transport Minister Mark Garneau said that there's no evidence of novel coronavirus transmission on commercial airliners. What does the research tell us now about the risk for air passengers contracting COVID-19 on commercial flights?
Yeah, so there's been very few reports, extremely rare reports actually, of transmission aboard aircrafts. And I think we are learning more and more about some of the technologies, if you like, in terms of the ventilation and the way that aircraft ventilations work is actually, the modern aircraft is actually really good in terms of air exchanges and the way that the airflow occurs in the cabin. So there has been a few reports, but actually very, very little. I think we continue to ask provinces to report to us if you've seen reports to actual positive passengers, but have not demonstrated an actual transmission on board the aircraft itself. We have not received that kind of report. But the other thing is that in that setting, there are ways in which you could put in procedures like mask wearing. People are sitting facing the same direction with seat backs, in front of them. So there are a number of reasons, perhaps, as to why we are actually not seeing the actual conveyance itself as being a main area or setting of spread. Now, if you think of someone traveling from beginning to end, it may depend on where they come from, what they did before the flight, and what they are doing afterwards. That's really important for sure in terms of reduction of risk, and which is why we still have this quarantine period for people, for example, coming in from abroad.
And I just want to follow up on that with international flights. Since October 27th, 52 confirmed COVID cases have been traced back to international flights coming into Canada. So what's the resulting community spread from that, and why is it that travelers are not being mandated to quarantine at their port of entry, but rather their final destination?
Yes, so as just said, that the aircraft or the conveyance itself is probably not where the transmission is necessarily occurring. So getting people to observe public health measures and getting them to their place of quarantine is important. We ask everyone to have a quarantine plan, and that's being reviewed by the border service officers as someone comes in. There's a screening, obviously, for symptoms as people come in as well. So then it's just getting people to their place of quarantine if they have a plan in place. And so far, we have not, it may actually be quite a difficult thing to ascertain. We have heard reports of people inside that 14-day quarantine period being positive, but we have not heard of reports of transmission as a result of individuals. But for sure, there's, the risk of introduction is there, but we're not getting the reports about onward transmission as a result. So I think it's layers and layers of protection. Every layer gives you a different, an added layer of protection of all the airport measures, the screening when someone comes in, the fact that they're wearing a mask, they get to the destination with instructions not to, go shopping on the way there, get to the place of quarantine. They've already demonstrated a quarantine plan, and that's how, we are managing and with that 14-day quarantine period. As you know, we are examining pilots in terms of, for example, in Alberta, where they're testing someone as they enter, and then later on can help us look at what that quarantine period might look like going into the future.
Thank you. And Dr. Tam and Minister LeBlanc will now have to depart, but Dr. Njoo and the ministers will still be here as well. Okay, Dr. Tam will be here for a few more moments, though.
Hi, Minister Anand, it's Tonda again. Thanks for your earlier answer with all that detail. Can you speak to a couple of things I'm wondering about? Do you see a role, given that, you've got a bunch of companies that are, in theory, interested in contracting with you to do the delivery, but do you see a role for the Canadian Army in actually making sure that that happens? Maybe, if you don't have a good offer to those companies, maybe they won't be interested. So do you see a role for the Army? Why doesn't Canada have already a dedicated IT platform to do the tracking and tracing of all the data that's going to be needed to track the vaccines, each samples, make sure that things get followed up on, that the right conditions were respected? We don't have that yet. So could you address those 2 points? Minister MacAulay's waving at me, sorry.
Actually, on that last part of your question, I will hand it over to Dr. Tam and Dr. Njoo after I speak to the first part of your question. I want to start by saying that the work on distribution of vaccines has been underway for months. We expect to have contracts in place for logistics service providers by the end of the month. It's an agile procurement system. We are conducting a competitive process while refining our requirements in consultation with industry experts, with public health expertise, and with provinces and territories. As we have done throughout the pandemic, we need to act together with the provinces and territories and across government to overcome the hurdles ahead of us. I will say that we are very well placed to have this complete system put in place prior to the approval of vaccines by Health Canada. It is this proactive approach which is going to stand us in good stead. I will also say, in reference to the armed forces, our government acted very quickly when the need was present earlier in the spring to send the armed forces, which we are so grateful that they did, into the long-term care homes in Ontario and Quebec. This was an incredible effort by the CAF, and our government and Canadians at large are extremely grateful for this effort, especially as we approach Remembrance Day tomorrow. In terms of the vaccine distribution piece, all options are indeed on the table. We are having a cross-government discussion about this, and in fact, just prior to this press conference, I was in the COVID Committee of Cabinet discussing many of these logistical issues that we are being asked about today. So we are working very hard on it. We are putting in place very, very strong systems, and we are working collaboratively with provinces and territories to do so because we recognize the importance for Canadians across the board in this regard.
So to add, there's an extremely meticulous process right now in working with the provinces and territories. As everyone understands, the provinces and territories are the primary responsible jurisdiction in terms of vaccine programs and vaccine delivery. So we are working with them, not just on the procurement side, the access side, the supplies, of course, coordinating all of that. So that a lot of work has been done to map out the existing logistical roadmap, if you like, and all the different capacity in the provinces and territories so that we can also identify gaps that need to be filled. So not only is there multilateral fora, we have the Vaccine Supply Working Group, the Canadian Immunization Committee, other federal, provincial, territorial bodies that normally come together when we look at our routine immunization programs, but that we have helped map out every step and the logistical requirements. Right now is an intensive sort of discussion really has to be bilaterally with the different jurisdictions to work out the precision on the delivery, I think, that you're thinking about. Keeping in mind that some vaccines, and each one has different characteristics and different requirements. So that is how the discussions are going at the moment, from the minus 70 plus sort of supply chain versus others, which are much more traditional and people are much more used to. So I think the federal government's there to help with particularly with the more unusual supply and requirements, but has to be worked out with the manufacturer, of course. So there's these different components are coming together to make a decision on the precision on that supply state. So it is a very complex process that has undergone extensive mapping, and then now it's just addressing what those needs are. And it will not be, one size fits all. The existing distribution patterns in each of the jurisdictions are already a bit different. And so we actually have to work with those. But the full extent of the rollout approach includes not just logistics, of course, but as you say, the monitoring, not just distribution, but the coverage, who got what. You need to have 2 doses. That has to be logged so that someone gets the second dose on the right time. So these are some of the details. But also, while Health Canada and the process for safety and effectiveness phase 3 trial and the results will be reviewed in a rigorous manner, we still have to monitor vaccine safety and effectiveness as things are rolling out. So all of those pieces come together as part of some of the key implementation considerations.
So my follow-up, I asked about whether there was an IT platform. Why don't we have an IT platform that can do all that right now? They've built a purpose-built one in the U.S. We don't seem to have that, if I'm correct. And Minister Anand, I just want to also ask, you were asked earlier by somebody about the timeline, and in your procurement documents, they reference Q2 2022 for the length of time these logistical distribution contracts would be, executed. Is that not the timeline then you're thinking for all Canadians to be vaccinated? So my 2 questions again were IT and the timeline.
Well, I will speak to the timeline, and I will allow and ask the doctors to speak to the IT piece. On the timeline, Tonda, there is the requirement for Health Canada approval. And so our contracts and our distribution mechanisms are contingent on that, as we've said repeatedly. And so the timeline really revolves around that approval process. Regardless of what is in our contracts, no vaccine will be distributed until those approvals are granted by Health Canada in the interest of health and safety. And as I said, we are a government that follows the science, and that's exactly what we will do. In terms of what our procurement documents say, I'm actually very interested in your characterization because they're not uniform in terms of what is said regarding delivery timelines. And to some degree, those delivery dates are being continually negotiated as we see these companies come through phase 3 clinical trials and as the rolling review process takes place in Health Canada. So as I said, our delivery timelines are consistent with many other jurisdictions, including the European Union, Japan and New Zealand, and Australia. And we are expecting, if all goes well with Health Canada approvals, to be able to distribute vaccines in the first part of 2021. And we will continue to put in place the complex logistics system in order to make sure that those deliveries to the provinces and territories occur efficiently and effectively.
Just to add that the transfer of information is part of that rollout plan that has to be discussed with provinces and territories, and it's part of the intense implementation planning that is being done. But, you know, obviously there has to be a balance, because you can't sort of putting up entirely new IT platforms in the middle of an emergency has pros and cons. So we really do need to understand the extent to which those requirements are. And so those types of requirements are being mapped out as well, including the IT requirements. As Minister Anand has said, you know, I think from a public health perspective, we have to plan with certain scenario as though we're going to get vaccine from a certain point in time so that you can be ready. It's possible those timelines will move, for sure, depending on clinical trial results and many other factors along the way in between the clinical trial itself and getting the vaccine actually on the ground. Lots of things can shift, and we have to be able to flexibly shift with that. But I think from a planning perspective, we are, you know, setting ourselves up so that public health authorities will be able to, in sort of optimistic timelines, look at some of the deliveries being done in the beginning, sort of quarter one of 2021. As to how all the other vaccines or the other vaccines that been where there's agreement will roll out, some of them we haven't seen a single result from the phase 3 yet. So those timelines will necessarily move and be flexible, but then we need to be ready. So which is why mapping out, you know, the logistics right now in detail is really very, very important.
Thank you. That concludes today's press conference.
Thank you. The conference is now ended.